Hi, welcome back. So today we're just talking about medical aid. Did you know that the medical aids, they give you the fees or the funds for a dental checkup, clean every 6 months? So that is biannually. It's not only dentists who are encouraging that, your medical aid is also encouraging that, so that we are able to check your mouth, check for any oral diseases, cancers, cavities, if there's any major issues that you should look for. And then we also take the radiographs to check if there's any impacted teeth that might give you any problems in the future. Also do the dental cleaning to prevent further accumulation of plaque and calculus in your mouth, to also give you a bespoke oral hygiene instructions, because yes, there's a general one and there's also a bespoke one depending on your conditions as well, which is why when you go to a dentist, we'll give you a questionnaire so that you are able to inform us if you have any other diseases that we should take into consideration in our treatment, and also in our educational part when we educate you about taking care of your teeth. So those are the things that the medical aid covers for, so that you are able to save your tooth, to prevent further expenses later on. If you skip those appointments, you would not know if you have any issues with your teeth until it's late. And most of the time when it's late, most of the medical aids don't cover certain expensive treatment like the root canal treatment, the crowns, or they cover partly because they try to prevent that by giving you the 6 months funds for cleaning and dental checkup. So it's really important that you take upon those funds and use them in terms of checking your mouth. I'm not saying this because I'm a dentist and I want you to come to me. I'm just saying that as a general health education, which I've been doing all the years, you don't necessarily have to come to me. Just go to any dentist, do your dental checkup, do the radiographs. You can ask them to take the radiographs so that you can check everything to make sure that they don't miss anything. Do an oral cancer screening. Most of the time they do it, we do it. Do the pictures as well. If they have the scan, allow them to take the scan and show you the bite and how the bite of your teeth in terms of how you're biting. If there's any contraindications in the way that you're biting, that they can check, that they can fix as well. They can also check your TMJ as well. So I really encourage you to visit your dentist every 6 months. Go for your checkup, go for your cleaning, do the radiographs, go for a general checkup just to prevent, just like you'd go yearly for your annual health check for your high blood, your diabetes, and so forth and so forth, and the blood test as well to check other underlying conditions. Also, dentistry is very important because it's not isolated from the mouth, it is in the mouth, and it's also in the middle of all the vital structures, in the middle of the heart. It's closer to the heart, not in the middle. It's in the middle of the brain and the heart. So it's connected to the brain, the upper teeth are connected to the brain, very closely connected, and the lower jaw all the way to the heart, with the biggest artery on the left side of your neck. So it's really important to really visit the dentist. It's not isolated from your general health. It is part of your general well-being as well. Okay, going for the dental checkup, let's say we find that you need a dental cavity. Most of the time it's that small that you didn't realize you had it. So it's cheaper to fill it than when the cavity is quite bigger, because it will require extensive work. So the medical aids most of the time they are willing to pay for such restorations because they are preventing you to having a crown in the future. So the medical aids look out for you, but you need to look out for yourself as well. So please visit your dentist, go for your dental checkup, go for your dental cleaning. Whether you have the medical aid or not, I was just emphasizing on what the medical aid offers. Even if you don't have the medical aid, save up, call your nearest dentist and find out how much it is, and probably prepay for it. You know, lay by your dental checkup, you know, every 6 months. If it means you pop out a debit or have a debit order of 100 rand that go to your dentist, so that in every 6 months, then you make yourself accountable to go for a checkup. Please do that. Take care of your health, and thank you for tuning in. If you have any questions, please insert that below, and then I will answer them later. Thank you. Bye.